Standardized testing is very important at all levels. The ages of students with whom we work are typically 10 years old on up through and including the graduate school exams. Depending upon the specific school to which a student is applying, that might determine what weight the specific school puts on the relevance of the testing. Of course, it's important to note that there are many other factors that are relevant, but standardized testing is typically very important in all levels. Many schools allocate merit scholarships largely based upon standardized test scores. While there can be many factors, the standardized test scores tend to be a very important part of it.
All right, so let's go on to question number 6.
An instrumental component of assessing a student's progress when they're being prepped for standardized testing is having the students take proctored practice tests to figure out how they are progressing. The information that we get from this is very important to the instructor because it helps in a personalized way decide what needs to be focused on in the ensuing sessions.
Good. The first page of that section.
The SAT and ACT are instrumental tests for students who are in high school. And while it's not the case that the SATs or ACTs represent the full admissions picture, they do represent a very substantial part of the admissions process. Over the past couple of decades, the number of spots has remained relatively constant, but the number of students applying, in many cases, it's doubled or tripled, which means that the demand for these spots has greatly outstripped the supply, so that demand has really driven the intensity of the SAT-ACT process. Most colleges view the SAT and the ACT similarly, so the issue of which test a student should take should be driven by how he or she will score on the test. The tests are geared towards different types of learning styles. For example, the SAT is more of a puzzle-based test. It's more of a problem-solving test, whereas the ACT more replicates what's done in a classroom setting. If a student takes a diagnostic practice test in the SAT and ACT, which we offer, what would happen is we could then determine whether a student would be better suited to prepare for one test or the other. The services that we provide are very personalized. We work on a one-on-one basis or in a small group setting. This personalized service tends to maximize the scores that students will achieve on their tests.